Working for your health tonight with the goal of addressing a region-wide shortage of mental and behavioral health services. Providence today unveiled a new outpatient day treatment program for people struggling with suicide, depression, and anxiety. Our Hawk Hammer working for you with more on how this plays into the bigger health care picture. Hawk?
Nadine, doctors and nurses at Providence are seeing more and more people with depression, suicidality, and anxiety turning up to emergency rooms, which aren't set up for long-term care. This program hopes to address them before it even goes that far. Empty rooms right now will soon become a safe haven for the growing number of folks in need of mental health care.
The need is out there in our communities.
Art, yoga, group sessions, individualized medication management with psychiatrists. It's nothing new, but the way Providence is setting their new RISE program up for both adults and adolescents, it's a first for the area.
There isn't another one like it east of the Cascades. Not only are we doing adolescents, which others haven't done, but we're also we're taking any insurance, anybody who's in need.
Sheehan, who oversees the hospital's work in behavioral health, says patients will be able to come in as much as 5 times a week, far more frequently than is typical with outpatient work. Critical access, especially for youth.
But Spokane adolescent suicide rates are some of the highest in the nation.
When this ward opens up in the coming weeks, there will be space for upwards of 25 patients, a number which is expected to double by the new year. Patients will come largely from referrals, school counselors, primary care, or even emergency rooms.
It can be working professionals, it can be students. It doesn't matter, right? Mental illness doesn't discriminate.
But across the board, the treatment will start with developing these skills.
Mindfulness, interpersonal effectiveness, emotion regulation, distress tolerance, and we also do self-care and safety.
Better understanding how to handle triggers, cope with emotions, and learning it all together. And the hospital, in addition to having psychiatrists on staff, will also have nurse practitioners, social workers, and psychologists. It's really across-the-board care, again, looking to serve as a step before depression, anxiety, or suicide get bad enough to require emergency room care. Hawk Hammer, KXLY 4 News.
Thank you, Hawk.